Hello everyone! Today, I'm going to introduce to you the phases of dengue fever. Understanding the systemic and dynamic nature of dengue infection, as well as its pathophysiological changes during each phase, would produce a rational approach in the management of dengue infection. The incubation period for dengue infection is 4 to 7 days, but it can range up from 3 to 14 days. After the incubation period, the illness begins abruptly, followed by three phases: febrile, critical, and recovery phase. Dengue fever may be asymptomatic or may result in a spectrum of illnesses, ranging from undifferentiated mild febrile illness to severe disease, with or without plasma leakage and organ impairment. The clinical course of symptomatic dengue fever is a systemic and dynamic disease with clinical, hematological, and serological profiles changing from day to day. These changes accelerate within hours or even minutes during the critical phase, particularly in those with plasma leakage. During the febrile phase, patients suddenly develop high-grade fever that usually lasts 2 to 7 days. It is often accompanied by facial flushing, rash, generalized body ache, vomiting, and headache. Some patients may have sore throat, injected pharynx, and conjunctival injection. Mild hemorrhagic manifestations like petechiae and mucosal membrane bleed may be seen. Pervaginal bleed may occur in females but rarely massive. Gastrointestinal bleed is not uncommon. The earliest abnormality in the full blood count is a progressive disease in total white cell count, followed by platelet reduction. This should alert the doctor to a high index of suspicion of dengue infection. This disease should be notified as early as possible for preventive measures. Clinical features of dengue infection are rather non-specific and may mimic many other diseases, therefore can be easily misinterpreted. A high index of suspicion and appropriate history taking, particularly with regards to a recent stay in dengue hotspots or clusters of fever in the neighborhood, are useful for early and accurate diagnosis of dengue infection. In addition, a dengue fever patient may have a co-infection by another pathogen. Diseases that may mimic dengue fever includes other viral illnesses. Organ dysfunction can occur in other diseases apart from dengue infection and should be investigated. The critical phase often occurs after the third day of fever, or around the effervescence indicated by a rapid drop in temperature. The critical phase lasts about 24 to 48 hours. Varying circulatory disturbances can develop. It is important to note that thrombocytopenia and hemoconcentration are usually detectable in this phase. The hematocrit level correlates well with plasma volume loss and disease severity. However, interpretation of hematocrit may be difficult when there are confounding factors such as hemorrhage, excessive fluid replacement, or in hemodilutional state. Leukopenia with relative lymphocytosis, clotting abnormalities, elevation of transaminases are usually observed. This phase coincides with an increase in capillary permeability in patients. In other viral infections, the patient's condition improves as the temperature subsides. But the contrary happens in severe dengue infection, whereby the patient may deteriorate and manifest third space plasma leakage or organ dysfunction. In less severe cases, these changes are minimal and transient. Many of these patients either recover spontaneously or after a short period of fluid therapy. In more severe cases of plasma leakage, the patient may develop compensated or decompensated shock, abdominal pain, persistent vomiting with or without diarrhea, restlessness, altered conscious level, clinical fluid accumulation, mucosal bleed, or tender liver, are the clinical warning signs of dengue infection with high possibility of complications. Organ dysfunctions such as hepatitis, encephalitis, and myocarditis usually occur during this phase. The recovery or reabsorption phase occurs after 24 to 48 hours of critical phase. Usually plasma leakage stops, followed by the reabsorption of extravascular fluid. The patient's general well-being improves, appetite returns, hemodynamic status stabilizes, and diuresis ensues. Some patients may have the classical rash of Isles of Wight in the seas of red with generalized pruritus. It is important to note that during this phase, the hematocrit level stabilizes and drops further due to hemodilution following the reabsorption of extravascular fluid. The recovery of platelet count is typically preceded by the recovery of white cell count. In some instances, organ dysfunctions may worsen, such as hepatitis, encephalitis, and intracranial bleed, as the patient re-enters reabsorption phase. This table summarizes the different phases of dengue fever. Do consider repeating this video and taking some time to go through the entire table. Thank you for staying until the end. If you find this video helpful, do not forget to share and consider watching our other videos on dengue fever. See you next week.